What if your body has been trying to warn you about something serious, but you've been ignoring the signs? Imagine waking up feeling just a little off. Maybe you've been more tired than usual, or your appetite isn't what it used to be. Nothing major, right? But what if those seemingly small changes were actually early warning signs of something much bigger, something life-threatening? Cancer is one of the most deceptive diseases out there. It starts silently, often hiding behind symptoms that seem minor or unrelated. But catching it early can make all the difference. In today's video, we're uncovering 12 crucial warning signs of cancer that most people overlook. Some of these symptoms might seem harmless, but they could be your body's way of pleading for attention. Ignoring them? That could be a mistake. But recognizing them early? That could save your life, or the life of someone you love. Let's get started. 1. Unexplained fevers and night sweats. A fever is usually a sign that your body is fighting an infection. But what if you're experiencing persistent, unexplained fevers without any signs of illness? This could be a red flag for cancers like leukemia, lymphoma, or kidney cancer, which affect your immune system and disrupt your body's ability to regulate temperature. Night sweats, especially those that soak your clothes and sheets, are another symptom often linked to these cancers. While occasional sweating at night is normal, excessive sweating for no apparent reason could indicate something more serious. Cancer-related fevers and night sweats happen because tumors release inflammatory chemicals that raise your body temperature, mimicking an infection. If these symptoms persist for weeks, especially if accompanied by fatigue, weight loss, or swollen lymph nodes, it's crucial to seek medical advice. While infections and hormonal imbalances can also cause these issues, consistent, unexplained fevers and night sweats should never be ignored. Early detection could make all the difference in catching cancer before it progresses. 2. Sudden changes in appetite. A sudden, unexplained change in appetite, whether it's a dramatic increase or a complete loss of interest in food, could be a warning sign of an underlying health issue, including cancer. While stress, hormonal shifts, and digestive problems can affect hunger, persistent appetite changes should not be ignored. A loss of appetite is particularly concerning when paired with unintentional weight loss, as it can indicate cancers like stomach, pancreatic, liver, or ovarian cancer. These cancers can interfere with digestion, metabolism, or hormone production, making food less appealing or causing a constant feeling of fullness, even after eating small portions. On the other hand, a sudden increase in appetite could be linked to conditions like insulin-producing tumors, insulinomas, or certain types of brain tumors affecting hunger-regulating areas. If you notice persistent appetite changes, especially when combined with fatigue, nausea, bloating, or pain, it's essential to consult a doctor. Listening to your body and identifying unexplained shifts early could be life-saving. 3. Chronic cough or hoarseness. A cough that lingers for weeks or a persistent hoarse voice could be more than just a sign of allergies, a cold, or acid reflux. It might indicate a serious underlying condition, including cancer. A chronic cough that doesn't improve, especially if it produces blood or is accompanied by chest pain, shortness of breath, or unexplained weight loss, may be an early sign of lung cancer. Lung tumors can irritate the airways, causing persistent coughing that doesn't go away with standard treatments. Similarly, persistent hoarseness, a raspy or weak voice, can be a warning sign of throat, laryngeal, voice box, or thyroid cancer. Tumors in these areas can put pressure on the vocal cords or disrupt nerve function, leading to voice changes that last more than 2 weeks. If your cough or hoarseness persists without a clear cause, especially if you're a smoker or have a history of exposure to pollutants, it's crucial to seek medical advice. 4. Unusual skin changes. Your skin can reveal a lot about your health, and certain changes might be early warning signs of cancer. New moles, changes in existing moles, or persistent skin sores that don't heal could indicate melanoma or other skin cancers. Be especially cautious if a mole becomes asymmetrical, has irregular borders, changes color, grows in size, or starts bleeding, these are classic signs of a potential malignancy. But it's not just moles, other unusual skin changes can also be concerning. Yellowing of the skin and eyes, jaundice, may signal liver or pancreatic cancer, while persistent itching or darkened patches could point to underlying internal cancers. Thicken, velvety dark skin, acanthosis nigricans, might even be linked to increased cancer risk, especially in the stomach or pancreas. If you notice red, scaly patches, lumps under the skin, or sores that won't heal, don't ignore them. Your skin is your body's largest organ, and early detection of abnormalities could be life-saving. Always get persistent or unusual skin changes checked by a doctor. 5. Trouble swallowing. Difficulty swallowing, also known as dysphagia, can sometimes be caused by minor issues like acid reflux. However, if you experience persistent trouble swallowing, a sensation of food getting stuck, pain when swallowing, or frequent choking, it could be an early warning sign of a more serious condition, including esophageal, throat, or even lung cancer. Esophageal cancer, in particular, often starts with mild swallowing difficulties that progressively worsen. At first, you might struggle with solid foods, but over time, even liquids can become difficult to swallow. This happens because a growing tumor narrows the esophagus, making it harder for food and drink to pass through. Unexplained hoarseness, persistent cough, chest pain, or unintentional weight loss alongside difficulty swallowing are additional red flags. In some cases, individuals may also experience regurgitation of food or a chronic feeling of something being stuck in their throat. If you've been dealing with persistent swallowing issues, don't ignore them. Early diagnosis is crucial. 6. Lumps under the skin. Discovering a lump under your skin can be alarming, but not all lumps are cancerous. Many are harmless cysts, swollen lymph nodes, or fatty growths called lipomas. However, if a lump is firm, painless, growing in size, or feels fixed in place, it could be a sign of something more serious, like a tumor or lymphoma. Cancerous lumps often appear in areas like the breast, neck, armpits, or groin, where lymph nodes are located. If you notice multiple swollen lymph nodes that persist for weeks or feel unusually hard, it's important to get checked. Some warning signs to watch for include skin changes over the lump, redness, warmth, or ulceration. Additionally, if the lump is accompanied by unexplained weight loss, night sweats, or prolonged fatigue, it could indicate an underlying systemic issue. While not every lump is dangerous, ignoring a persistent or unusual mass isn't worth the risk. 7. Unexplained bleeding. Experiencing unexplained bleeding can be alarming and should never be ignored. While minor causes like gum irritation or hemorrhoids are common, persistent or unusual bleeding may signal a more serious issue, including cancer. Bleeding from the gums, nose, or rectum, or blood in the urine, stool, or cough, could indicate underlying conditions such as colon, bladder, lung, or oral cancer. Women who experience postmenopausal bleeding or irregular vaginal bleeding should seek medical attention, as this could be a sign of uterine or cervical cancer. Blood in the stool, especially dark or tarry stools, may suggest gastrointestinal bleeding, potentially linked to colon cancer or ulcers. Similarly, coughing up blood could be a warning sign of lung cancer. If you notice frequent bruising, heavy nosebleeds, or prolonged bleeding from minor cuts, it could also indicate a blood disorder or leukemia. Regardless of the cause, unexplained bleeding should always be evaluated by a doctor to rule out serious conditions and receive appropriate treatment. 8. Persistent changes in bowel or bladder habits. Your bowel and bladder habits are good indicators of overall health, and persistent changes may signal an underlying issue, including digestive or urinary tract cancers. If you experience chronic constipation, diarrhea, or a sudden change in stool shape, such as pencil-thin stools, that lasts for more than a few weeks, it could indicate colon or rectal cancer. Blood in the stool, whether bright red or dark, is another red flag that requires immediate medical attention. Similarly, changes in bladder habits, such as frequent urination, pain while urinating, or blood in the urine, could be signs of bladder, kidney, or prostate cancer. If you feel the constant urge to urinate but only pass small amounts, this could indicate a tumor pressing on the bladder. Occasional digestive or urinary changes are normal, but when symptoms persist or worsen, it's important to consult a doctor. 9. Chronic fatigue that won't go away. Feeling tired after a long day is normal, but persistent, unrelenting fatigue that doesn't improve with rest could signal a serious underlying issue, including cancer. Cancer-related fatigue is different from everyday tiredness. It can feel overwhelming, draining, and persistent. This type of exhaustion often doesn't improve with sleep and may be accompanied by weakness, dizziness, or shortness of breath. It can result from the body's immune response to cancer, the energy demands of tumor growth, or anemia caused by certain cancers, such as leukemia, lymphoma, or colon cancer. Chronic fatigue may also be linked to cancers that interfere with nutrient absorption, such as stomach or pancreatic cancer, leading to deficiencies that worsen exhaustion. If fatigue comes with unexplained weight loss, night sweats, or persistent pain, it's crucial to see a doctor. While many conditions can cause fatigue, when it persists for weeks or months without a clear cause, it's essential to rule out serious health concerns, including cancer, through medical evaluation. 10. Persistent pain in one area. Pain is a common symptom, but when it becomes persistent, localized, and unexplained, it could be a warning sign of an underlying issue, including cancer. Unlike temporary aches from an injury or strain, cancer-related pain lingers for weeks or months and doesn't improve with rest or treatment. The nature of the pain varies depending on the type and location of cancer. For example, persistent headaches that don't respond to medication could indicate a brain tumor, while chronic bone pain might be linked to bone cancer or metastases from another cancer. If you experience ongoing abdominal pain, it could be related to cancers of the pancreas, liver, or colon. Cancer-related pain often worsens over time, and it may come with other symptoms like unexplained weight loss, fatigue, or swelling. If you have persistent pain in one area that has no clear cause and doesn't improve, it's essential to see a doctor. 11. Sudden and unexplained weight loss. Losing weight without trying might sound like a dream come true, but when it's sudden and unexplained, it could be a serious red flag. If you drop 10 pounds or more without changes in diet or exercise, it might be a sign of an underlying health issue, including cancer. Cancer-related weight loss happens because tumors can alter metabolism, causing the body to burn calories faster than usual. Cancers of the stomach, pancreas, esophagus, or lungs are especially known for triggering unexplained weight loss. Other symptoms, such as loss of appetite, nausea, or changes in digestion, may also accompany the weight drop. Unlike weight loss from lifestyle changes, cancer-related weight loss tends to be rapid and persistent, occurring over weeks or months. If you experience ongoing, significant weight loss without a clear reason, it's crucial to consult a doctor. Catching potential issues early can lead to more effective treatment and better health outcomes. Never ignore your body's warning signs. 12. Frequent infections or weak immune system. If you're constantly battling colds, flu, or other infections, it could be more than just bad luck. It might be a warning sign of something serious. A weakened immune system makes it harder for your body to fight off bacteria and viruses, leaving you vulnerable to frequent illnesses. Certain types of cancer, such as leukemia and lymphoma, can compromise the immune system by affecting white blood cells, which are essential for fighting infections. Symptoms may include persistent fevers, swollen lymph nodes, chronic fatigue, and slow-healing wounds. Additionally, if you notice that minor infections, like a simple cut or sore throat, take longer to heal or keep coming back, your immune system may be struggling. Other warning signs include night sweats, unexplained bruising, or extreme tiredness. Your body has a way of signaling when something isn't right. The key is paying attention. If you or someone you love is experiencing any of these symptoms for an extended period, don't wait, get checked. Early detection saves lives. The sooner cancer is caught, the better the chances of beating it. So, have you noticed any of these signs before? Share your thoughts in the comments, and if you found this video helpful, don't forget to like, subscribe, and share to help spread awareness. Stay informed, stay healthy, and take care of yourself. See you in the next video.